Welcome to our penultimate session here on day one at the inaugural Abu Dhabi Global Healthcare Week. We are super excited to invite the next guest onto our stage. This is a very timely and topical discussion area, which has its taboos. Its taboos are mainly about being underreported. There's many myths to be busted. And so this woman has a big challenge on her hands over the next 20 minutes or so. She's going to be taking us through her insight on this subject. Now, without further ado, Dr. Louise Newson, please do join me on stage, physician and menopause specialist and founder of the Newson Health and Balance app. Please give her a big round of applause. Thank you. Dr. Louise Newson, you are a leading figure in menopause care and an expert in so many different fields. But this particular area, why did you choose to focus on it? And you have a very exciting book in your hands, which I think the answer to those both questions could be tied.
Yeah, so I've been a physician for many years, but I'm really interested in inequality of care, actually, and about global health, and also about longevity. We've listened a lot today about longevity and how important it is that we keep well. But actually, a lot of women are suffering. A lot of women haven't understood what the menopause is for so long. And so the more I listen, the more I hear stories, the more injustice there is, actually, because women are not able to receive the right advice, support, help, and treatment.
Absolutely. And we mentioned in the introduction that this is timely and topical, underreported, globally underreported.
Absolutely. This is only something that affects 51% of the population directly.
Only.
And 49% indirectly, because every man will know a woman or work with a woman or be related to a woman. So it's absolutely scandalous that it's not been spoken about enough before, actually.
And it would be scandalous for me to leave this stage without plugging your book, which is doing phenomenally well. The name of the book is, if people want to look it up, The Definitive Guide
To the Perimenopause and Menopause. So it's an updated version of the hardback, and the hardback got into the Sunday Times bestsellers list, and this got into number 8 the first week it's been out.
Please do hold it up for the audience and look it up. Look up Dr. Louise Newson after this particular session. For the next 20 minutes or so, give her your undivided attention. Over to you, Dr. Louise. Thank you.
Thank you very much. So it is a real privilege to be here, and I'm quite unusual in that I'm a physician, so I'm not a gynecologist. So I'm interested in health of women, not women's health. Slight difference in words, but really important when we think about longevity, think about importance of staying well and living well. So I've come over from Stratford-upon-Avon, which is known as Shakespeare's birthplace, but we're actually making it the menopause capital of the world. There's a lot that goes on there. But it's more than just a clinic where I work. I've developed the Balance app, which has now had over 1 million downloads globally. It's been app of the day a few times. We've worked very hard to enable many people to reach it. I do a lot of education for healthcare professionals as well as for women and men. I do a lot of research. I collaboratively work with various universities in the UK, and I do a lot of outreach work as well. And for some of you might know, I'm quite active in media and social media. So this is an example of some of the work that I've done. I've been a medical writer for 25 years, and our website has over 4,500 resources that are all free for people to access. So the app is something that came out because I started struggling with symptoms a few years ago, and I had no idea what was going on. And I wish I had something that was in my pocket where I could monitor symptoms, get information, and work out what was going on for me. So I've already said we've had over 1 million downloads of it. But this is something that came out from the McKinsey report quite recently, and this is really, really important. So there is a moral imperative to address the women's health gap and improve the lives and livelihoods of billions of women worldwide. Really important, and when you look at this report, just looking at these figures should make people stop and think more about women. So 75 million years of life lost to poor health or early death each year. So that's not each decade, it's each year. And we know that better health has a ripple effect on communities. And women's health isn't a standalone issue. It's equivalent to 7 days per woman per year. We've heard about in the workplace how people are struggling. And addressing this gap could actually lead to 137 million women accessing full-time positions at work by 2040. I'm on the government menopause task force, and we know that around 10% of women give up their jobs as a direct consequence of the menopause, usually symptoms due to brain fog, memory problems, anxiety, fatigue. So changing air conditioning temperature isn't going to help those women. So I wanted to talk about a patient I saw. I see many women. In our clinic, we see around 3,500 women a month through our clinic. We're the largest menopause clinic in the world. They're not all in Stratford-upon-Avon. We do online consultations as well. So Laura had struggled with symptoms for 8 years. She used to work as an accountant. She gave it up because she couldn't remember facts and figures. She then went to work as a receptionist in a veterinary clinic, and then couldn't remember her password at work and felt very tired, ended up working as a cleaner, and then gave up her job. So when I saw her, she'd been 4 years unemployed. She'd been diagnosed with raised blood pressure, she'd had type 2 diabetes, she was obese. She also had osteoarthritis, and she'd recently had a bone scan, and she had osteoporosis as well. So she was existing rather than living. She was really struggling. She'd been to see lots of doctors, and no one had really thought about her periods or about her menopause. And these are some really poignant quotes. These are from her words, but I hear these words every day in my clinic. So this lady says, I had many symptoms and saw many doctors. Not one of them made the connection, and I was clueless. I didn't know I was perimenopausal, and this is the time before periods stop. She was prescribed painkillers for migraines, sleeping tablets for sleepless nights, antacids for indigestion, antidepressants, antibiotics, statins, blood pressure tablets. We already know the trillions of dollars that is spent by Big Pharma, and she's contributing to that. She was broken, lost, confused. She didn't like what she'd become, and she'd considered ending it. And I'm sorry this is a very depressing talk for the end of the day, but we are funding a PhD student in suicide prevention because the incidence of suicide increases 7 times in women in their late 40s. And she said, it was the worst time of my life. Prescription drugs and therapy didn't help me. And I'll come back at the end to show you what did. So we need to think about what the menopause is. It's been branded around a lot, but actually it's not just about periods. I don't know who gave this definition that women have to wait a whole year without having a period, and then a doctor or nurse or anybody can tell us that we're menopausal. I don't want to be defined as my periods, and I don't want to be defined whether I'm fertile or not. It's far more than that. We also need to think about PMS, which is premenstrual syndrome, the time before periods, and PMDD, premenstrual dysphoric disorder, which affects around 1 in 20 women who have very severe symptoms just before their periods. And perimenopause, when symptoms occur but periods are happening, which can occur for 10 years or so before the menopause. So we can't just talk about the menopause because we're excluding a lot of women. And it's really when our hormones, estrogen, estradiol, the biologically active important estrogen, progesterone and testosterone, they're just chemical messengers that work throughout our body and affect every single cell in our body. And we need to think about it as a women's hormone insufficiency because that's what it is. And it is a problem. I've already said 100% of women will be affected globally. How much information has been given over the last decades or centuries about menopause? Very little, if any at all, really, that's made a big impact. And there's 1.2 billion menopausal women. There's a lot of us that need to be heard, we need to be listened to. And the figures speak for themselves. 47 million women reach the menopause every year. But we're struggling to be heard. Many people have to go and visit their doctors several times just before getting a diagnosis. They have to wait a long time for treatment. They're being medicalized, as indeed this patient is, with incorrect medication. And the bigger problem is we have evidence-based treatment in the role of hormones, but actually only 5% of women globally are receiving that treatment. I can't think of any other area of medicine where people are unable to access an evidence-based treatment. There are a myriad of symptoms. The larger words are more common symptoms. But if you look, it's no coincidence that the words that are bigger are symptoms that are affecting our brains. So memory problems, low mood, fatigue, brain fog, anxiety, irritability. Of course, hot flushes and sweats are there, but they're not nearly as common as people think. And Lisa Mosconi is a great neuroscientist I know very well in New York, and she recently quoted that menopause affects the brain as much as it impacts the ovaries, which is very true. And this is showing just very, very simplistic. This is a bit of brain, and it's showing at the top, without estrogen, there's this pro-inflammatory signaling, increased inflammation going on in the brain. But actually, the blue dots, which is the estrogen, the estradiol, when it goes onto the receptors, is very neuroprotective, which means protecting nerves. Really important roles in our brain. And this is a very simplistic picture of a brain, and it's showing areas where estrogen and testosterone work in the brain. They work everywhere, but these are the really important areas. So these areas determine our personality. They determine the way we think, the way we perform, even the way we breathe, the way our heart beats. We've learned from Henry today about the amygdala, thinking about how we like food and our sort of satiation as well. But our hormones also work as neurotransmitters, so they affect the levels of dopamine, of serotonin, adrenaline, noradrenaline, cortisol in our brain and throughout our system as well. Really important, because you can see when we don't have those hormones, our brains don't light up like Christmas trees. They're not stimulated in the same way, and that's why these symptoms are so common. We've heard about life expectancy, and I've put this purple dotted line through 50, which is the average age of the menopause in the UK, but certain countries it's a lot younger, it's more in their 40s. So you can see 100 years or so ago, we didn't live as long. Menopause wasn't such a priority, but now we are living so much longer. A lot of women are now 30% of their life or more without their hormones. And we know that actually by 2100, there'll be so many more of us that will be menopausal, really draining healthcare systems. So we know that we want to keep healthy. We want to keep healthy, but there is this lifespan gap of around 9 years, and it's increased the earlier people are when they're menopausal. And young women can be menopausal too. 1 in 30 women under the age of 40 have an earlier menopause. My youngest patient was only 14, so no one is too young. But it's not just the symptoms, it's the major health conditions for me as a physician that really worry. We have a 5 times increased incidence of cardiovascular disease, dementia. We're all scared of dementia, but the commonest cause of death for women globally is cardiovascular disease and dementia. Type 2 diabetes, osteoporosis, clinical depression, kidney disease, cancer, obesity, and earlier death. These are all associated with low hormones that occur during the menopause. And this is fact. We've known it for decades, but it's been ignored for a long time. And then thinking about inflammaging, a term that some of you might have heard, this low-grade inflammation that occurs the longer that we live. And actually, it's associated with aging, but it increases our risk of diseases, and it affects everybody in the system. This is a really beautiful picture, I think, of someone who's got a pathology degree of a macrophage, so one of our white blood cells that's really crucial for infection. And it's giving out a whole load of chemicals, cytokines, so that's what's being sprayed out. And we want our macrophages, our immune system, to be really healthy. And guess what? We've got estrogen receptors on every single immune cell. Really important, because when we have adequate estrogen in our bloodstream, it activates and primes and genetically reprograms these cells. I'm not going to read this through, don't worry, but it's showing you at the bottom is the macrophage with the estrogen receptors on it. And there are 3 different receptors, and they all activate various really important chemicals, cytokines in our body. And the endothelium is the lining of our blood vessels. And so with estrogen in our body, the lining of the blood vessels is kept really, really healthy, and all that inflammation reduces. This is another lovely picture. Some of you might see it or know. It's a mitochondria. It's a powerhouse of our cells. We've got trillions of cells in our body, and we've got lots of mitochondria in every single cell. Really important they're looked after, and I'm very interested in mitochondrial dysfunction. We talk about all the aging processes that occur, that increase with this inflammatory processes. And actually, every single one of these processes is monitored and dictated, if you like, by not just estradiol, but by testosterone and progesterone as well. And actually, men have estrogen, and men have progesterone, and of course they have testosterone too. So really important when we're looking at men and women. But guess what? All the diseases that are associated with inflammation are exactly the same as the list of the diseases associated with the menopause. So the etiology is the same. The pathophysiology, if you like, is exactly the same. But it's not all doom and gloom. There is actually treatment. We've got a hormone treatment. We've had it for years, actually. And all we do is give back the missing hormones. There's different doses, there's different types. But it's very, very safe because the hormones we now prescribe are biochemically and structurally the same as the hormones we produce when we're younger. Very different to synthetic hormones that have been given in the past. So we know that it improves symptoms because we're replacing the missing hormones, we're treating the underlying cause. But more importantly than that, actually, when women take hormones, it improves their future health. We've known it for many, many years. And no surprise, actually, all the diseases that increase during the menopause reduce. We know that women who take HRT, hormone replacement therapy, are actually live longer. They also live healthier, and they have a far lower incidence of heart disease and all these other conditions, including dementia. And actually, compared to someone who takes statins, for example, there's more evidence that taking HRT will reduce risk of cardiovascular disease. So just going back to the lady at the end, she was given hormone replacement therapy to help her symptoms and improve her future health. And her symptoms improved. She had no more symptoms. But actually what's really important is the second part, actually. She had stopped taking so many other medications. And in the clinic, we de-prescribe all the time. So I'm not very popular with pharma, but actually isn't that important for the individual that she can stay well and keep well, and she's now got a job, so she's now employed, which is really important. So just finally, leaving with you this quote that some of you might have heard before. And when you're thinking about menopause, it's really crucial for us as individuals that we stay well and we keep well, and enabling more women to have access to safe, prescribable hormone replacement is going to be a game changer. We can look at all these other medications, but we've got it under our noses, but we're not allowing women to have access to it. So hopefully this is the start of a conversation that we can continue. So thank you.
Thank you so much, Dr. Louise. I had a chance to actually have a briefing about your particular discussion area ahead of today, so it's fascinating to hear you deliver it to our wonderful audience here as well. I believe this message will really resonate in this region and in this country. We began by talking about how it's underreported. That's a real interest for you, isn't it, to increase the global awareness?
Yeah, absolutely. And a lot of my work with using app and social media is allowing people to access information that they would never been privy before. You know, when I qualified, there was no internet, there was no Dr. Google. We had to go to books or rely on what doctors told us. And sadly, a lot of training for healthcare professionals has been inadequate. We've got an education program that's been downloaded by 33,000 clinicians worldwide. And that's making a huge difference, a really positive impact for women.
That's fantastic. Now, there's a lot more to delve into in Dr. Louise's book. Please do take a note of the name. Do any of our audience want to put a question? We've got one gentleman here. Anybody else? And a lady over there as well. So let's get mics to our two audience members. Very quick questions, please. Do we have a mic handy, or I can share mine?
Thanks so much. Dr. Andrew Jeremenko. My wife, I've been trying to get her to take hormone therapy because I agree with you. I think this is great. She's scared of breast cancer. She's had 3 friends die of breast cancer. She's scared of cancer. What do you say? Because that fear is really stopping her from actually doing something that could be good.
And it's the biggest reason why people are scared of HRT. Really important to reassure her, actually. 1 in 7 women will get breast cancer whether they take HRT or not. But actually, women who take estrogen have a lower incidence of breast cancer. The risk was actually misreported, and it was with older types of synthetic progestogens. So the natural hormones that we prescribe now, not associated with any risk, and all the other health benefits as well.
Thank you very much.
Fantastic. And then we've got another audience member who had a question. A good friend of M42. Hello.
actually a Dr. Louise superfan.
Just mic all the way up, please.
Sorry, I said I'm a Dr. Louise superfan. So firstly, thank you for speaking about this. I think, along with our friend here, Donna from the MIMO, this needs to be spoken about more. It's such a big problem, so thank you, thank you. Do you have a question?
Yeah. I think on behalf of our members at MEMO, so it's the Middle East Menopause Organisation, I can't begin to tell you the difference that you've made to all of our members. The Balance app that you created, it's downloaded so many times on the group. So on behalf of all our members, it's a huge thank you. You've given so many women their lives back. So thank you
That's
very much.
such wonderful and positive feedback. Thank you for sharing that. Really appreciate it. And to our audience members, we love this interaction. We want to make sure we continue it. Dr. Louise is joining us tomorrow. I hear that this is breaking news. You're going to be part of our 4 p.m. session on biotech and women's health. So a final question, and before we release you to return to the stage tomorrow. At the beginning, you made that distinction that you, not so much women's health. Elaborate on that distinction again.
So I think when people talk about women's health,
Yes.
they think about periods, they think about gynecological issues, really important, of course, and I see lots of women with endometriosis, fertility problems, but actually when we talk about health of women, then we're thinking about cardiovascular disease, dementia, type 2 diabetes, really important diseases that is affecting our morbidity and our mortality.
And you come to it from a broader perspective, and I think that's super fascinating.
Yeah, absolutely. I mean, I've got a pathology degree, but I'm also a physician. I've been a hospital physician for many years and then segued into family practice. So very different to gynecologists, actually.
Oh, we're so pleased to have you as part of our particular program here and as part of the Longevity Forum's partnership. I'm going to get a quick photograph with you before we release you, and then we have our very final panel discussion, so bear with us. We're going to be back on stage as soon as we've got the stage set for our wonderful audience. So just a quick photograph with Dr. Louise. Thank you.